Hi all. This is our second round with treating Brittany. So some updates that we had today. Her gait has improved. She had decrease in her scissoring gait. It's still present, but with verbal cues, it decreases quite a bit, which is great. We performed a 2-minute walk test, which had 330 feet. The norm for her age and gender is 656 feet, so some room for improvement. We're not sure if her decrease in distance was due to motivation or endurance or strength, so we're going to do some further testing to figure that out. Her functional ambulation classification moved up to level 3, which is just dependent for supervision, so someone should be with her at all times, but physical assistance isn't necessary to help her maintain balance as much anymore. Her agitation has decreased quite a bit. She's now down to moderate agitation at a 29 on the agitated behavior scale, and she has an increased ability to follow directions. Possible strength deficits, we may have some hip flexion or hip weakness because we notice some decreased amplitude of hip flexion during gait and with balance activities such as marching. Is this due to motivation or strength deficits? We're not sure, so we're going to do some more concrete strength testing in future sessions. Balance has increased during gait, as well as her ability to perform single leg stance for short periods of time, a couple seconds, but she does have increased balance and decreased impulsivity in running to walls or any type of tripping has kind of decreased. Social, she made some inappropriate statements today, kind of showing that she's moved forward to that confused inappropriate state. And she is asking about her mother, so we're hoping we can have some more information on that and her social background as we continue.
As far as patient prognosis goes, we are improving from good to now good to excellent. Some of the factors include her age. She's only 20, so she's still pretty young. Ranchos Los Amigos stage progression is moving quickly. She started at a level 4 when we first eval'd her, and now she's at a level 5 just at the next day. So moving through those stages quickly is a good sign. At this point, there's no comorbidities, but we are keeping an eye out for anything that might throw us off. And her functional ability is good at this point. She is able to walk with contact guards, just kind of there for supervision. Same with her transfers, sit to stand, she's good with that. So functionally strong. So these are all positive factors to improve from good to excellent for her prognosis.
So when looking at our criteria for discharge, we're hoping to get some more subjective information to know her prior level of function, as well as where we should discharge her, where she lived beforehand, things such as that, what support she'll have. Medical stability, we want her to be stable in terms of her intracranial pressure, anything that's necessary after her craniotomy, things such as that, just to make sure that she's ready to move to the next stage. Appropriate mental status, we want her to be able to take care of herself and be safe, so we would like to have her a little less confused before discharge. Ability to tolerate other therapy settings, so this kind of goes into the mental status as well as endurance. If she's going into someplace such as an inpatient rehab, we want her to be able to participate in those therapy levels. And then lastly, her functional status. No matter where she goes, we want her to have some basic ADLs that she's able to do and an ability to take care of herself and be safe.
So for evidence-based practice, we found an article that was talking about the intervention principles for those that have moderate to severe TBI. So they talked about using whole practice rather than breaking a task into parts. So we tried to do that with Brittany today, just doing our balance interventions and walking in general. And then they also talked about consistency of the environment to decrease their distraction and short, frequent sessions to also help minimize distraction. So what we did today is just doing like circuit style with Brittany, so a short bout of ambulation, then a short bout of the standing balance activities and switching between those so that she wasn't as bored. We also used demonstration like the article recommended, so we had the text demonstrate while the main therapist was guarding, and then we kept all of the instructions for Brittany very brief so that she wasn't getting bored or distracted at all. Thank you guys, and we'll see you tomorrow.